Hello, everyone. My name is Eleonora Mani. I work as events coordinator, in-house interpreter and translator at ISC International, Istituto di Scienze Cognitive. And as you know, ISC is the official organizer of the well-known Congress, the Attachment and Trauma Congress. And this year, our 12th edition will take place finally in Rome from September 30 to October 2nd, and will be titled Attachment and Trauma: Effective Clinical Interventions and Research. And today I am really delighted to welcome one of our eminent speakers who will give an online lecture at the Congress this year, and will discuss the effectiveness of EMDR in the treatment of trauma and attachment disturbances. So I'm really glad to welcome Dr. Roger Solomon here. Hello, Roger. Thank you for your time and thank you for being with us today.
Hello, Eleonora.
Thank you. So I would like to ask you a very simple question. Can you please summarize the main topics that you will discuss during your online talk at the Attachment Trauma Congress on September 30?
I'm going to talk about the utilization of EMDR therapy for traumatic attachment to the perpetrator. So if I can just explain more.
Yes, of course.
That first of all, when there is abuse as a child, it's terrible, it's awful. But what can really complicate it is the relationship to the abuser, particularly if they are in a position of trust. So this particularly ties into the topic of attachment. Attachment, as our good friend Giovanni Leotti put it, is not love. Attachment is safety. And so the person that one depends upon for safety is also the source of terror. Now, this creates a disorganized attachment, and disorganized attachment underlies complex trauma and dissociative disorder. Also, there can be an abuser who's not within the family, but it can be another adult, it can be a family friend. And in the case examples that I'm going to present, one will involve a stepfather and the other will involve a gardener who formed a relationship with a 6-year-old girl who was very needy. So what happens is that there can be grooming, or the abuser develops a relationship with the victim. And the victim may start to look at the perpetrator with an attachment, and then there's the abuse. So this complicates the trauma. What we have is the trauma of the abuse, and this is terrible. But we also have a traumatic attachment to the abuser. You know, someone I look to for safety, for connection, is the person that's abusing me. So this also has to be addressed. Now, fundamentally, what can make a person very vulnerable to trauma and to the manipulations of an abuser is a disorganized attachment and early childhood. We are wired to connect. And again, when we don't get our needs met, we can have an insecure or disorganized attachment. And this creates a vulnerability to later manipulations. So at some point, we have to go back and also treat the earlier childhood caregiver interactions that created the vulnerability. So in summary, the treatment model I'm going to be talking about is how we can use EMDR therapy to first treat the terrible trauma of the abuse. And we can also use EMDR therapy to treat the traumatic attachment to the abuser. You know, the person that I was looking to for connection is the person that's abusing me. So there's betrayal, but there's also guilt that can be there. It's my fault, and we have to deal with this. And also, we also have to deal with the underlying early childhood interactions that may give rise to a disorganized attachment in order to complete integration. EMDR therapy is an evidence-based treatment for psychological trauma. And psychological trauma is not only the great, big, huge, big T trauma of, say, like abuse. It's also the seemingly small, but very impactful memories like mother's angry look, or I needed help and father turned his back, and something that's so pervasive. I'm alone. I'm not seen. I'm invisible. And this is what can create the vulnerability to the manipulations of an abuser later in life. So this is the topic I'm going to be talking about.
Well, it sounds, yeah, of course.
I'm going to be illustrating this with videotapes of actual client sessions.
That's great. That will certainly be a added value, I think, for the participants to have, you know, to be able to watch these tapes commented by you. And so it really sounds a complex but fascinating topic, Roger, and I'm sure that you will provide the audience with really valuable insights, even if you will just you will give your talk online. I'm sure it will be a very enriching learning experience for them. But just one more question, and the very last one. Why would you recommend to a mental health professional, to a clinician, attending the Attachment and Trauma Congress?
Well, as I was saying before, attachment, the need for connection and safety is very fundamental to human beings. And understanding attachment theory, the interactions with the caregiver and early, especially in early child, is fundamental to understanding present day problems. So why this conference is important, it is going to address the fundamental issue that all of us therapists need to deal with, and that is the attachment relationships our clients had. As I said before, research has shown that disorganized attachment, insecure attachments, disorganized type, underlies complex trauma and dissociative disorder. And though we certainly want to treat present symptoms and earlier traumas, to complete integration, enhance integration, we have to deal with the attachment relationships of early childhood. So this conference is addressing a very important topic that is always timely. And also the group of presenters, I'm not talking about myself, but the rest of the faculty are just amazing.
Thank you. Thank you so much, Roger. We really look forward to having you at the Congress it's a shame that you will not be able to be there in person, but I'm sure that your online talk will be really valuable. And then you will also attend a panel discussion live, so you will virtually be there, and we really look forward to that. So
Indeed, and I want to make myself as available as I possibly can be online and interact as much as the online format will allow me to.
sure.
I really appreciate this opportunity to participate in this Congress.
Absolutely. We are really grateful that you accepted our invitation, and I would like to thank you so much for your time and for this very short interview. Thank you so much again, Roger. See you soon.
Okay.